Hello there and welcome to yet another episode of Kalekia's Health Moments. Our guest today talks about two issues, cancer survival and mental health.
My name is Emily Mukomunene. I am an author. I do research on topical issues, especially health, and I present the matters in a layman's language. Layman means non-medical language. You can be an engineer, but you don't understand the medical language. So I want you to understand about your body, about your health, and things that can help you sustain yourself as a health person. We've been more focused on matters related to cancer. The reason being that we have the rising numbers of cancer incidences in Kenya. And as of old, we used to think that cancer was a disease of people who have lived long enough. In Kiswahili tulikuwa tunasema wenye wamekaa na wamekula chumvi mingi is when cancer used to develop in the body. But currently we've seen very young people, both boys and girls, even children, who are being diagnosed with the cancer. This cancer, you just keep on falling sick. You go to the hospital. Most of the times you are treated. Then eventually, on and off, then one day you are told you have cancer. Then the shock of it, and having known that when the people who have previously been diagnosed with cancer, the records we have is people who have lost their lives. They're isolated, leave their families devastated because of the treatment cost. At the same time, the emotional implication of cancer, a disease that one does not understand. So the mystery of cancer, it's even deeper now than the mystery of HIV when HIV came many years back, because we already know how you can be HIV positive, how you can be able to acquire the HIV virus. But for cancer, it is still, we cannot for sure say that this is what will make you be cancer positive, because we will not say it is the food that you eat. We will not be able to say it is smoking. We have seen people who have smoked over 90 years and they have not developed any type of cancer. Yeah, so it still becomes a mystery, and that is why I decided to get into the field, at least to lessen the curiosity of the people in understanding the disease. That is through I carry out personal research, and I relate a lot with the caregivers, the family members, and even the cancer patients, so that you can be able to get to know what is their history, what are the things that, the habits, that they have been involved with before they started falling sick, and then what was their experience before they were diagnosed with cancer. For how long, what spells of time did they go to consult with a doctor, and how effective was that consultation? And then also to understand from them the medicine they were given before they were told they were cancer positive, or they had a particular kind of cancer. Did that medicine improve their situation, or it made the situation worse? Those are the things that we are trying to get out as a form also of encouraging us to understand the early signs of cancer. Health education is where you make people get to know what are the risk factors. Risk factors is the factors people who have gotten involved in a particular habit or exposure for a long time, and the records that show that people exposed to that habit have developed a certain type of cancer. For example, like people who develop lung cancer or throat cancer, most of them, they have known either to have been exposed to smoke, passive smoke, or cigarette smoking, as I've just given the example. But you find people living in the rural areas, people who have not even, they are not exposed to the carbon emissions we face here here in the cities. They're developing throat cancer. You find women whom you would not expect that they would have smoked a cigarette or anything that is related to puffing, developing throat cancer. So that one provokes our curiosity. How did they get it? But remember, we are talking about exposure, continuous exposure to a particular carcinogen. Carcinogen is an associated factor. So when you go to the ground to find out how did this mama develop throat cancer, and she's never smoked, and maybe she has never lived with people who have smoked, then we go back to the olden days and find out where is the smoke in that house. The smoke that family is exposed to, it is the firewood smoke. But remember, firewood by itself, the smoke from firewood is not supposed to be harmful to our health. Because firewood, we've always cooked with it. Before anything else, before the gas and the stoves and everything, and even the charcoal, we used to use the firewood. So what is the difference between the firewood that was used in the ancient times and the firewood we are using now? On my research, I found out that the firewood, the current generation, even back home, those who are using firewood, you go to the farm, to the forest, you cut the trees, you get the firewood, you get with it to the house, immediately you light the fire with that firewood. That is what we do currently. You hear somebody saying, nenda ulete kuni. Hiyo kuni inaletwa, you put it on the fire. Remember, that kuni is wet. That kuni is going to emanate some carbon, which is not good for your health. That kuni, whatever smoke that will come from there has chemicals that will affect your health. So I found that is where you find people in the rural areas developing throat cancer when they have not been exposed to what is known as cancer-associated factors like cigarette smoking or even alcohol itself. It's because we are using firewood which is not dry. In the ancient times, we used to put the firewood. They would put on the rooftop. So the new firewood, put it far, then the other one is on this side. So you cook with a dry one. You go systematically, you keep on pushing forward. Use the old stock, and the new stock you keep on putting it back. So as you clear the old stock, the other new stock is drying up. We are not doing that. And that's why we're saying we need health education. People need to be educated about these things. Also, we find because of the time factor, we have no time to prepare even the meals in our house. You know, things that come fast, they go fast. If you cook the food fast, the nutrients are also destroyed within a very short time. They are destroyed. So when you consume that food, you will see as if you have taken a balanced diet or a nutritious meal. But actually what you have taken, you will find almost 75% of the value of that food has been consumed by the fire. When you're going for cancer test, you're just going to be tested to see maybe why this disease is not responding, and why you have a swelling somewhere, or why you have this body change somewhere. So maybe even on your mind, you do not know, you are told go for a biopsy. You don't even, in your mind, you are not thinking it might be cancer. But the minute you go for that biopsy, and the fluid is positive, cancer positive, you need to be prepared first of all. Let the person who's breaking the news take you aside, talk to you, ask you, have you experienced any kind of illness? What do you know about diabetics? What do you know about tuberculosis? What do you know about malaria? What do you know about cancer? Are you getting me? So that one now is groundbreaking for you. So when the person takes you through and to explain to them what to know each one of them, they'll ask you, how would you feel if you are diagnosed, you are told you are diabetic or you are hypertensive? How would you react? Do you know somebody who has that disease? So this patient or this potential patient will say, well, in my family, there's so and so, or there's a friend of mine who was hypertensive, but is very well controlled in MPESA. They say, and supposing it was you, what of cancer? Do you know somebody who has cancer? What of if it was you? How would you? Then the medical person will be able to guide the patient, prepare them how to receive the positive results. At the same time, it is good to prepare them on the kind of treatment that they are supposed to undergo. Or maybe after the first testing, depending if he's not able to portray the stage of diagnosis or the organ of origin, the doctor should be able to guide you and tell you, although we have diagnosed this, there might be a possibility this might not be the organ of origin. The organ of origin, that means there's somebody who's diagnosed with the breast cancer because the lump has been spotted at a particular place. But as they start treating, they are preparing to treat or even to go to take the patient for surgery. The patient develops something else, they start coughing. And most of the times the patient will dismiss that cough. They say, the ikifu inakaanga tu. I always cough on and off. Are you getting me? But now, because they are being prepared to go to the hospital, chances are we'll encourage the patients to go tell the doctor, hey, and I'm also coughing, and yet I'm preparing I'm supposed to go for surgery in 2 weeks' time. If that doctor is a professional doctor who understands what is ahead, they will say, before you go for surgery, go to a chest specialist. They'll take the history of the patient. They'll tell the patient, give me the history. For how long have you been coughing? Do you take medicine? Which came first? Is it what we have seen, the tumor or the cough? They say, I've been coughing for the last 2 years or 3 years. That should, in by itself, should alarm the medical person to guide this patient to go for a chest x-ray. Are you getting me? And prepare the patient and say, because you've been coughing, just even before, as we are waiting to go for the surgery, for the breast surgery, why don't you go for the chest? So that we check, we evaluate how ready you are for the surgery that is ahead of you. And maybe there's a possibility that you might, maybe the cancer is in the lungs. I've seen people who have been diagnosed with the breast cancer, and you find that the organ of origin is where? Is in the lungs. Yeah. So when you prepare a patient that way, they go with an open mind because there is an open communication. They understand that this is the step to take, this is the next step that you are going to take. Then, also preparing a patient about treatment, the cost of treatment, and the kind of treatment and the kind of care that to expect from the family members, and even the diet and food. That one prepares them so that they know now, if I've been taking 2 or 3 bottles of soda per day, from now, my lifestyle has to change. I cannot take that one because I have been diagnosed with this cancer, this type of cancer. I am going to undergo this kind of treatment, and for the treatment to be effective, I must be conscious about what I eat and what I drink. It's unfortunate that there is also stigma for people who are cancer positive or who have been diagnosed with cancer. And the reason is, what we think is one of the reasons is because cancer is still a mysterious disease. We've heard people saying that if you have been diagnosed with cancer, that is witchcraft. Yani umerogwa. Or you are paying for the sins of your family members. Or it's a punishment from God. So that by itself is a stigma. It pulls you away from other people. It means, because if you have been accused of something, when you are suffering from a disease, it means you are already an outcast. So stigma must be handled properly for cancer patients, like the way we did with the HIV. And how can we handle stigma for cancer patients or even their family? It is first of all demystifying the disease, cancer. Because if we understand that we are all at risk of cancer, as we are all daily exposed to the carcinogens or the cancer risk factors, then we'll not be able to stigmatize the people who have been diagnosed with cancer. So we need to set up desks, train people. Now, this not necessarily medics, people who will be able to take somebody through the counseling process, even educate the public on what cancer is all about. That is in the public barazas, in the churches, in the mosques. We must have people talking about the risk factors of cancer, so that cancer is disassociated with the myths of witchcraft, curses, and failure in the society. So we don't expect the people who are in the rural areas all the time to have the network is working, or even have the credit facility to access the internet bundles. But when there is a book, a child has a book in the house, or even a book is on the family table, or a book that people are given in the church, you can easily check and say, huyu mgonjwa anahara sana. Mwingine atasema, and I read even that continuous diarrhea is a side effect of the chemo that the patient was given at that time. And what are we supposed to eat? Let's not eat high fiber foods, because the knowledge is there. So somebody will open the book and check and say, no, no, no. In fact, what we are cooking, our patient cannot eat that, because it will increase the diarrhea. It will increase the vomiting. That is where I came up with the idea of empowering people with simple knowledge, with books. Like this one, Focus on Cancer. It's a book that talks about what is cancer, different types of cancers, the treatment methods that are used, the kind of questions to ask your doctor. It talks more, emphasizes on the side effects of different treatment methods. If it's radiation, if it is surgery, the chemotherapy, which is known to have a lot of side effects, and most of them are short-lived side effects. You just need to know how to handle them, on what to do and what not to do when you're experiencing a certain side effects. That's why I have a book like Focus on Cancer. It is patient-friendly, it is family-friendly for caregivers, written in a layman's language. That is my language of communication. On my interaction with the patients at KUNH, I had put a table there. I just wanted a forum. And I was talking about cancer and at the same time tuberculosis. When I interacted with the patients is when I realized there's a lot of ignorance in the society. Because you find I have a patient who is admitted. This patient is being treated for diabetes. And I'm coming as a mother or even as a wife, taking to my beloved one some good snack to make them happy when they're in the hospital. Can you guess what snack I'm taking? Soda and cake for somebody who's under diabetes treatment. So when I saw that, I got a very bad experience because I talked to them and said to them, why are you doing this? You are taking to a diabetes patient? Because they would come to my tent as they wait for the time for the gates to be open. We'll talk. Then I tell them, but you cannot take that. Soda, you don't love this person. I was very rude at that time. You say you don't love this person. Otherwise you will not be taken to them. You want them to die. Then somebody will be mad. You are mad, you are evil. How can you tell me that I want my person to die? Because I said, but that sugar you are taking is being treated of too much sugar in the body. What nutrition value is in that food you are taking? So as I took the caregivers, the relatives, through the process of nutrition, I realized there was a lot of ignorance. And I asked them, are you not told these things in the hospital? The nurses, the doctors don't tell them. They say, no, we are not told. The only thing we are given is the paper to go and buy the medicine or the bill to go to the pharmacy there and get the medicine done. We are not told anything about the food. I said, no, the doctor must be crazy. That's why I wrote this book, The Doctor Must Be Crazy. Because later on, I went to talk to the doctors and the medical students. And when I asked them, they said, they come, there are so many patients, we diagnose them and prescribe the medicine. Yeah, and it's unfortunate sometimes even we form very close bonds. The doctor said we form very close bonds, even the nurses with the patients. And when they are discharged, those who are admitted, and we give them appointments, most of the times we expect them to come for the appointment. When they don't come, we say, they must have gotten well. Only to see in the newspaper we lost them. Among my other books, you can see the whole lot of them, but they are all written from one each to understand, filling the gap between the doctors, the patients, and the families.
Well, that's it for today. Our guest emphasizes the need for psychological support for cancer patients because they are dealing with a brutal disease. Please subscribe to our channel, or you can like this video. Leave your comments below so that we can interact with you, and visit our website kalekehealth.com.